Okay, great. Okay, so thanks for having me, everyone, and Julia for inviting me. So my name is Laura McDonald. Julia introduced me already. So I'm just going to quickly talk about the PEI Smoking Cessation Program, which is a newer program as of December 2019. So just a quick reference, I work out of the Chief Public Health Office in the Sullivan Building, and in our office we focus on tobacco, and currently I work in the Health Promotion Unit, living tobacco free, but we also have someone else hired under Environmental Health who does the protection piece. So we focus on World Health Organization 3 pillars of tobacco control, so the protection. So as of recently banning vaping flavors, so that would be something similar to that, Smoke-Free Places Act. Prevention, we focus on prevention as well, which Julie and I both sit on a group together, and then cessation, so the PEI tobacco cessation program. So I'm going to talk quickly about the tobacco cessation program, what it is and how you can enroll. And any questions at all, you can ask later or send me an email. My email is connected to at the end of this presentation. So the smoking cessation program helps all islanders by providing 100% coverage of nicotine replacement therapy or prescription medication. So anyone who's currently smoking or has recently quit smoking and is looking for support, you can enroll in our program, and we cover the cost of nicotine replacement therapy products. So that would be patches, gum, lozenges, or the inhaler, or the 2 prescription medications, Zyban and Champix, and I know Craig's going to speak about those products after I'm done. So our program is actually accessed through primary care centers across the island, and you can only enroll once per year for a minimum of 6 weeks to a maximum of 18 weeks of treatment. So that's for someone who's a heavy smoker perhaps, or has smoked for a number of years. We extended our enrollment period of 18 weeks for those individuals to make sure that we're able to fully support you. So this program is open to all islanders. You do have to use tobacco products or smoke. Currently, we do not enroll individuals that only use vaping products, just because we're not quite sure yet of how to titrate individuals that are only vaping solely, but we're moving towards that goal. So where can you enroll? So primary care centers across the island, so not your family physician. If you don't have a family doctor, you don't need one. So primary care centers, there's 13 of them across the island, and what they do is they provide different types of programs and services. So COPD clinics, diabetes program, a number of services, and it's a primary care nurse that's trained in the Ottawa model for smoking cessation. And so what that is based on is providing 2 components really of the program, is the nicotine replacement therapy or medication, plus the counseling piece. So when you enroll, you can self-refer, or you can call me if you're looking to set an appointment. We will refer you to the primary care center in your area, and you will have a phone conversation with one of the RNs. Previous to COVID, you did have to go into the office and have an appointment, and the appointments are usually about 45 minutes. But now the appointments are via telephone. So it really does meet the needs of anyone that's perhaps working, night shifts or day shifts and they can't get in, or it's just not a suitable time. You can just now call over your lunch hour or step out for a moment and speak to the primary care nurse, which is really great. So they'll go through an assessment process with you. They'll ask you questions similar to how often do you smoke? When are you willing to quit right now? When are you willing to set your quit date? So are you ready to set a quit date in the next month? So to be enrolled, you do have to agree to quit in the next month, and you have to be ready to quit. If you're not at that time and you're just looking for a conversation with a primary care nurse to prepare yourself, that's totally okay too. They're more than happy to have a conversation with you to prepare you. But if you are ready to quit, they complete an intake form for you. They send it to your pharmacy, and then to us as well, and then we set you up in the program. So based on the conversation you have with the nurse, they'll set you up for however many weeks that you could be enrolled, and also the product that you're interested in, and they will speak to you about the products as well. And a pharmacist is also a really good person to speak to you about NRT products or medications. So what they also do, part of this program, is the nicotine replacement therapy piece, which is very important for anyone that's looking to quit smoking. Plus, we provide you the support. So you don't have to worry about paying out of pocket for that. We actually pay for that, the government. So it's really fantastic. That's one less stressor for you. But then the nurse also does a follow-up counseling as well. So they will check in with you the first 2 weeks through the month and check in to see how you're doing. Are you having any withdrawal symptoms? Provide you advice. Do you want to go back in and see them or have another conversation a few weeks down the road? They provide that counseling to you. You also, when you do go to your pharmacy and you're visiting your pharmacy, you have those visits with the pharmacy or the pharmacy tech. So if you want to talk to the pharmacist, and you have any concerns at all, the pharmacist is always there for you as well. So this right here, the Cessation program client journey, it just kind of shows yourself when you're ready to quit, moving through the process of our program. So you're ready to quit, you make that first step of calling, you make that quit attempt, and you're visiting the pharmacy to pick up your products like you would any other medication, and then hopefully you're successful. But if you're not, you can enroll the next year, and you can enroll as many times once a year as you want until you are successful. So as I said, we ask you the 4 basic questions to assess your readiness to quit. So at the time, if you feel like you're not ready, that's okay. You can always come back, but we ask you how important it is for you to quit smoking, how confident you are at the time to quit smoking. Are you interested in quitting in the next month, and are you willing to set a quit date? We ask you about a quit date because oftentimes it can take time to prepare to quit. A long weekend's coming up. Maybe you feel like you'll be exposed to a social environment where there's people using tobacco. So this weekend is not a good weekend to quit. But next week on Wednesday, I'm going to make an effort to quit smoking, and that's the date that I want to quit. So I'm going to go to the pharmacy on next Wednesday and pick up my product. So that's why we ask you for the quit date. So just to note, this gives the primary care networks, this is just a slide that gives you an outline of what primary care networks are. We also do have another intake location, which I should mention because I've seen Jenny here on the call, the Cancer Treatment Center. If you are a patient at the Cancer Treatment Center, they do automatically enroll you in the program. Any questions at all? I know Jenny would be happy to answer those questions too about enrolling if you're a family member or a patient of the Cancer Treatment Center. But for anyone else, primary care is a great location for intake. They are all trained in the auto model. And if you do have other concerns outside of smoking, for example, and you may not have a family physician or any other practitioner that you see, they are a really good resource because they can connect you to other individuals. So if a diabetes, COPD, mental health, they can make those connections for you. So right now, primary care is the location of intake. We still are in our pilot project phase, but hopefully this program will be around for a long time and we can expand to other areas. This is just a map that represents the island and where the primary care locations are. There also are outreach locations. So if you don't see your community on this map and you're in a little smaller hub, there's usually an office close to you or an outreach location to where you are, like Lennox Island, for example. Also the follow-up piece. So even though the RNs are part of this program and they are supposed to be following up with you after your first initial appointment, we do have the option to refer you to the Smokers Helpline. The nurses always provide this option. Would you like to be followed up with Smokers Helpline? So they'll actually call you. So one of the quit coaches from Smokers Helpline will call you, or you can actually call them yourselves. And if you're not familiar with Smokers Helpline, which I'm sure most of you are, it is a free confidential service operated by the Canadian Cancer Society. And we've been working with them for years. And they do support individuals that are using tobacco products, smoking, vaping. They support youth, Indigenous populations. They really try to support as many people as they can, and they're a great resource. They also provide online support, phone, text messaging support, live chat options. And if you actually sign in to their website and join, they will send you, I believe it's monthly emails of resources and tips to help you maintain or try to prepare yourself to quit smoking, or they'll send you a free package with resources in it, including NRT products. So if you're preparing to quit smoking, you're just not sure what you want to try, because our program only does cover the cost of one product. You know, maybe you want to try gum and patches. They will send these options to you and you can try them for a period of time, whatever they send you. And then if you decide gum is your best option, then you know when you're ready to quit that, you want to try gum. So Smokers Helpline is a really good resource, and it's another available resource through our program. So that's basically the quick and dirty of the smoking cessation program. Any questions at all, you can email me, and my email's on this page here, or you can ask at the end of this presentation, or you can always just ask Julia as well. Thank you.
Hey, thanks so much for your presentation, Laura. That was great. It's really nice to hear that there's, you know, different options for people depending on their circumstances. Our next presenter is Craig Meek. He's a pharmacist who is going to speak about smoking cessation, and specifically get into more detail on some of the products that are available through the PEI cessation program. So Craig Meek received a Bachelor of Science degree in pharmacy from Dalhousie University. He's been practicing on PEI for over 15 years with Murphy's Pharmacy, and is passionate about helping Islanders with lung disease improve their quality of life, specifically helping Islanders quit smoking as well. So great. Take it away, Craig.
Okay. Thanks, Julia. Thanks, Laura. I just wanted to touch a bit. Laura mentioned about the intake program and the program that's available via Health PEI to residents who want to start some sort of smoking cessation product. I just want to talk a little bit about the pharmacotherapy and from the pharmacy standpoint, how we can help people interested in quitting smoking. So here we go. So we all know, yeah, as it's been said, quitting smoking is the single most important thing you can do for your health. The first two medications I wanted to touch on are the prescription medications, ones that require a written prescription, either from your doctor, or if you do the intake through Health PEI, that can be also prescribed there. So one newer one, and Champix, that you may have heard of, and one that's been around a little while is Zyban. So Champix is, like I said, it's the newest one that is on the market. It's a 12-week program. This one's unique in that it works on neurotransmitters or chemicals in the brain. So it actually blocks nicotine's effect in the brain that make you want to smoke. So it's taken daily. It's taken actually twice a day. The first 3 days you start at a lower dose, and the first week actually is a lower dosage, and then it increases after that. So it is a 12-week program. When you start Champix, you generally have the goal of quitting around the 7 to 14 day mark. So as you start taking it, you'll notice, or you should notice rather, that your cravings are decreasing as you take the medication. So side effect wise, Champix, it's not for everyone. I'll say, you know, there are some side effects. The most common thing we see with people is nausea or stomach upset. That is one challenge with Champix. But generally overall, it is well tolerated. Because it's working on chemicals in the brain, you can see some headache. Some people have a bit of insomnia or unusual dreams, or even changes in mood when they start it. Also to check with your pharmacist, check with your physician, or at the intake too, with your other medications, there are certain things to keep in mind if you're being prescribed Champix. So that's something we'll discuss if you do decide to try Champix. Then there's Bupropion or Zyban. This one's been around a little longer. Similar to the Champix, it's a daily medication taken daily to help you quit smoking. It also works on chemicals in the brain to help reduce cravings and also the nicotine withdrawal symptoms that you may have. So it originally marketed as an antidepressant, and interestingly enough, when they were studying this medication, they found that people who were smokers who were in the study ended up quitting smoking because they weren't having cravings for nicotine or for cigarettes while they were on the medication. So as you know, after that, it got marketed as Zyban and is a smoking cessation product that's on the market. It's generally a 12-week program as well, but you know, put a little asterisk there. You know, some people are on it longer than that, especially you know, it ends up working I guess as a twofer for, you know, if they have anxiety or suffer from depression. It's something that people will take longer, and it also works for smoking cessation. Similar to Champix, you do set a quit date. When you're starting out, usually it's around the 1 to 2 week mark with the Zyban. As with the Champix, there's some side effects that can happen. Anything, again, that's affecting chemicals in the brain can lead to things like headache, sometimes trouble sleeping, weird dreams. And also with the Zyban, one thing we can see is dry mouth, dry eyes, and also stomach upset. So those are the 2 prescription therapies. Wanted to discuss the nicotine replacement therapy, or NRT, very popular. These items can be bought, as you know, without a prescription. So anyone can come in and buy, whether it be Nicoderm, Nicorette, from their pharmacy. And as Laura said, they're also a part of the I was going to say 12-week program, but I guess it's 18-week program that is covered by Health PEI if you do the intake. So with nicotine, the most common ones we probably see that you're familiar with are the patch and the gum. Those are the first 2 to come out, but there's a lot of other new products. There's a mouth spray, there's an inhaler, and then there's lozenges as well. So I won't bore you guys too much with it, but I'm just gonna touch briefly on all of them. Most people are familiar with the patch, so Nicoderm and then the generics, but this is pretty much the easiest one for people. It's, you put a patch on, it's very easy, it's discreet. It delivers nicotine through your skin, from patch through your skin, gets absorbed over the course of the day as you have it on. With the patch, it's changed daily. Now, some people will take that off. They'll put it on in the morning. They'll take it off at bedtime. Some people will leave it on overnight. If you're a type of person or you smoke heavily and you smoke first thing in the morning as soon as you get up, I generally advise people to try leaving it on overnight to help reduce cravings in the morning, and then put a new one on in the morning. Some people, it does affect their sleep. They mention weird dreams or just having general insomnia. So if that's the case, take it off at bedtime, put a new one on in the morning, and go from there. So yeah, basically it's applied upper chest, upper body, your shoulders, upper back, and you want to rotate that site. Yeah. Side effects. Oh, I just wanted to touch briefly. This is a busy slide, but basically what I'm getting at here is if you look at the product, Nicoderm itself, or the generic patches, it'll give you if you smoke more than 10 cigarettes a day, do this. If you smoke less than 10 cigarettes a day, do this. And it has sort of a guide as what to use, but I cut and pasted the form that Laura and her team would use at Health PEI. And as you can see, not everyone's smoking, 11 cigarettes or 12 cigarettes or 50. Some people are smoking 40 cigarettes a day, 60 cigarettes a day. So if you look there at that time, you're going to increase the amount. So you'd actually be applying 2 of the step 1 patches and then decreasing it over the weeks from there. So that's basically what I wanted to point out there, is that the guidelines, I think this is based on the Ottawa model, certainly have changed from when Nicoderm came out originally. Side effects from the patch, generally well tolerated, but as it's a patch, so it's going to irritate the skin. Some people have redness or irritation. And then some of the nicotine, as nicotine is a stimulant, you see people having their heart races, they feel a bit dizzy, have a bit of a headache or some nausea. But that's with any of the nicotine replacement therapies can have that. The nicotine gum, so Nicorette, you may be familiar with, and the generics. The difference there being it's a fast-acting form of replacement. It's really good for cravings, and it's absorbed through the mouth. So basically, you chew on the gum. I'll go over how to use it in a sec, but it's chewed and it's absorbed into the mucosal membrane of the mouth. So it's available in a lot of different flavors. It's available in a couple different strengths. So it basically, you've probably heard of the chew park method. So you don't chew it like a regular piece of gum. Pop in a piece of gum, you chew it a bit, you feel like a peppery taste or a tingle, and you park it between your gum and your cheek. So it gets absorbed through the mouth space, basically. And you do this on and off, chew it again, park it, chew it again, park it. And it lasts about 20 or 30 minutes. The gum, they give sort of, again, there's a general set of directions or a stepwise approach to this based on how much you smoke, and over time, decreasing the amount of gum that you chew. With the gum, I mean, basically the advantages with the gum it's fast acting. It acts as breakthrough cravings. You can use it along with other forms of NRT. So you can be wearing a patch, you know, you head out for supper, after supper, you're having a craving as you normally would have a cigarette. So you can pop a piece of gum. So you're controlling the amount of nicotine you get. It can be used regularly for like a primary form of nicotine replacement or for smoking cessation, but a lot of people will use it like pop a piece of gum just as they need it. So possible adverse effects. Gum isn't for everybody, obviously. It can be hard on the jaw. It can cause sores in your mouth, leaves a bad taste in your mouth. And then the other usual nicotine replacement side effects like nausea and heart racing, that type of thing. I'll just touch basically on the lozenge. Probably not as popular as the gum, but there's a lozenge and a mini lozenge on the market right now. They're also fast acting. I guess the difference there is if someone doesn't like chewing gum, or they have issues with chewing, that type of thing, you can use a lozenge, which is dissolved in the mouth. It's absorbed in the mouth, similar to the gum, but it's a little more discreet and ideal for people who just don't like chewing gum, basically. So basically, yeah, it's not chewed, it's not swallowed. You suck on it, it dissolves, it's absorbed in the mouth. Move it around in your mouth, and it's absorbed in the mouth. And again, this is just the manufacturer's recommendation for the dosing, but you know, your pharmacist can go over all that with you when you decide to take the gum or the lozenge. This is the spray, the nicotine spray, or it's called the quick mist. To be honest with you, it's probably the least popular method personally that I see. I'm not sure if that's because it tastes bad. People just don't seem to respond or aren't drawn to this spray. But interestingly enough, it's the fastest acting form of nicotine. So that could be useful for someone who has a lot of breakthrough cravings. So it's something to keep in mind. It's just basically sprayed into the mouth like the gum, like the lozenge. It gets absorbed through the mucous membrane of the mouth. And this is just, again, the manufacturer's recommendation about using it initially and then gradually decreasing it over time. And all these products, like, they can be used interchangeably, or you know, they can be used along with one another too. Like, people will be using the patch and the gum, or the lozenge, or the inhaler. Which brings me to the inhaler, which is last but not least. So the inhaler, the big thing with the inhaler is it's good for people who have that hand-mouth ritual and like to do something with their hands, and they're used to smoking, and they have that habit. So basically, it's this plastic cartridge. I don't have one here to show you, but the picture kind of shows it. It looks like a cigarette, except you put these little nicotine cartridges in there, and then you inhale on it or suck on it like you would be a cigarette, and then the vapor gets absorbed into the mouth, similar to the gum, to the lozenge and the spray. So it gets absorbed through the mouth and then helps reduce your cravings. And oh yeah, so people wonder about like how long does it last? But you put it in a cartridge, and if you were to puff on it continuously, it lasts about 20 minutes. Or if you wanted to do 5 minutes at a time, you could do that 4 times. It'll make it last 4 times, etc. So you'll know when it's done, because you won't have that taste. You won't have that peppery, tingling feeling in your mouth when you're puffing on it. So yeah, and then side effects with the inhaler. The only one really different than some people find, they develop a cough when they're using the inhaler. But you know, otherwise it's similar to the other nicotine replacement therapies. It can increase your heart rate, and some people get a headache or dizziness with it. So that's my side of things. That's just a quick overview. Again, if you decide to either, you know, connect with Health PEI, do the intake and get approval, I think it's a great program in place. We've had a lot of people doing it. I think it's really groundbreaking that this is happening right now in our province. Finally, we have some coverage for nicotine replacement and smoking cessation products. There's a lot of good ones on the market. They're not for everybody, but definitely we can find something for you and tailor it to your needs. So yeah, that's everything for me.
Perfect. Oh, thanks so much, Craig. So I'm just going to talk for just 2 seconds. just about who we are. So we're the PEI Lung Association who's putting on this webinar today. We're a charity that's committed to assisting islanders to promote and participate in lung health through education, advocacy, and research. Our mission is to assist islanders and improve lung health. The reason why we chose to do this webinar right now is because starting on Tuesday, May 25th, we will be starting our Smoke Free Now challenge. So we started this last year during COVID to kind of, the idea was, you know, because smoking puts you at higher risk of complications if you were to get COVID. We felt that, you know, it was really important to get the message out how important it is to quit smoking. So we had a really good response last year. We had 45 islanders sign up for our challenge, and we had 11 people be successful in quitting smoking for the 4 weeks. So we will be starting our challenge again. So please help us spread the word or register yourself. To enter, participants must register on our registration page, which is just on our website. I can also send that link out when I'm sending out the video for these presentations. So you have to be over the age of 21 at the time of entry and be a current smoker. This campaign is, or this challenge is specifically for people who are using tobacco products. And the prize, we are accepting 50 registrations, and you will receive a $30 gift card for lobster from MR Seafood if you are successful for those 30 days. We do rely on the honor system for this challenge, but it's been very successful in the past. So I just kind of wanted to give a little quick overview about that. That you both did a really good job just sort of outlining some of the products that are available.
I have a question for Laura very quickly.
Okay.
So I just, with the 18-week, it being changed to 18 weeks, I was talking to a gentleman today, for example, who had tried Champix 6 months ago, and he couldn't tolerate it because of nausea. And I believe he only filled the starter pack, only did the first 4 weeks. So now would he be eligible, or would he be able to try like some other form like the nicotine replacement therapy? Would he still be able to get coverage for that?
That's a great question. We have these questions all the time, or the RNs receive them, or pharmacies receive them as well. So say outside of COVID, we're not in COVID times, the policy is you can only enroll once a year. If someone is having side effects like your client, whatever the reason is, or whatever reason, within the first month or a little bit after, we do try to, because typically they probably have the side effects within that first month. We do try to change them, switch them within that time frame where they're not going to be disrupted. So their treatment won't be disrupted. They'll still get their full weeks. We'll just extend them. So this individual, it didn't work out for him. It sounds like he's 6 months in, still probably smoking, I assume. What's happening now, we do have people re-enrolling the program because of COVID. So, COVID stress, COVID's not going anywhere. So we created the policy many months ago, and we weren't like very public about it because we didn't want, we really wanted people to try their best and not just rely on, well, I can re-enroll because of COVID. So anytime someone identifies perhaps to a pharmacy or one of their RNs that they weren't successful because of any stress related to COVID, they can re-enroll. So that's the policy right now. If it was outside of COVID and he was 6 months, he already enrolled in the program and he's just coming to you now and telling you, technically, no, he wouldn't be eligible to re-enroll. But, you can just he can just give me a call if he wants, or you can give him his primary care location.
I'll let him know. He picked up some Nicoderm today, so I'll let him know going forward that might be an option. So I'll touch base.
It's really challenging, and something that we hear often from pharmacists and RNs and numerous participants is they would like to have the opportunity to be able to re-enroll after 6 months. So if they weren't successful the first few months or first few weeks, trying again within the 6 months. So because it's such a new program and COVID has really disrupted a lot of things, We haven't made that change yet. We're really just waiting on our evaluation results, which we're hoping to have in the fall, which will be shared actually among the community pharmacies and of course our primary care networks and health networks. So then we'll actually see what's happening within the program. So it'll be interesting.
That's great. Thank you.
I just had a quick question. So just with the program, if you're using vaping products and cigarettes, then you would still be eligible?
Yes. So
Okay.
it's such a challenge because there's other provinces now that are recently have made changes, amended their cessation programs to include anyone that's just vaping. Because there's actually more evidence now coming out that does talk about titration for individuals that are solely vaping. It's just such a challenge because, as we all know, every vape pod or whatever it may be has different milligrams. So trying to appropriately titrate those individuals is challenging. So we are in communication with our partners, and we're researching a lot, and the Canadian Pediatric Society has some really great resources right now that are supporting solely youth who vape and putting them on say a patch or something. So we're looking into options because that's something that we hear often is from RNs is, someone came in, they're just vaping, where do we start them? Or if they're smoking and vaping, where do we start them? So it's a challenge. We're trying to correct it sooner than later because it's an ongoing issue, and I don't think vaping's going anywhere. I don't know, Craig, if you or if any of the RNs on right now, I know there's a few of you, have any feedback or have witnessed this or any insight into this. I'd be happy to hear.
I know, I think it's a big challenge. Vaping, no vaping product has been approved as a cessation product. That's a strong message that we like to clarify from our office. There's been, no sound research and no process that has found vaping to be a successful cessation method. So we just kind of want to get that point across. Just wondering too, Craig or Laura, like what is one of the more popular products that people choose? I know the patch kind of comes to my mind, but I'm just sort of wondering, like not officially, but just sort of, what do you find the most popular products are?
I can just speak for my program, and Craig, you probably have a better sense. But just in our program, patches are probably triple of every other product that people choose, and then it'd be Champix. So I think right now I can't remember how many people right now are on patches, but there's over 1,000 participants that are on patches, and we have the latest, I think it was 2,400 participants in the program in the last 2 years. So that's just what from the program. I can't speak to clients that go into pharmacies. Craig would be.
I would say the same. By far, in terms of NRT, the patches, absolutely, we sell a lot of patches. A lot of people so not only in the program with the intake sheets coming in, but actually just people walking in off the street and paying for it. Definitely the patch, and some people with the gum, I would say, being a second place in that in the NRT. And in terms of prescription therapy, Champix for sure. Zyban, we still do see the odd prescription with Zyban, but I think people and word of mouth as Islanders tend to know and do is that Champix worked for their friend, and they the efficacy is good, so people will often opt for Champix as before it was a bit of a hindrance if they didn't have private drug insurance or if their insurance didn't cover it because of the cost. But fortunately now there's the option of getting it in that program. So we're dispensing a lot of Champix for sure.
And Craig, I wanted to touch on this too, because it is something that we hear of often, because you do need a prescription for the medications. And if someone doesn't have a family physician and they don't want to go to a walk-in clinic to receive a prescription, and they are able to pay out of pocket, pharmacists can prescribe. So I always tell people that just in case they can, and Craig can speak to that more, but just there is that option, so people aren't left out on their own. because there's a lot of
Yeah.
people without doctors.
Yeah, and it's yeah, most recently like come into our scope of minor ailment prescribing with not nicotine smoking cessation products in general, right? So if someone doesn't have a family physician or they weren't able to do the assessment through Health PEI, then they can still come and talk to us and, you know, get something, you know, even get started on NRT, or but also with you know, the prescription like Champix, it's an option. So yeah, don't let that be a hindrance to the treatment.
No, I think it's amazing. Like, I know that here on PEI, we were really pushing for this program for a long time, and just to treat smoking cessation like healthcare, like it should be. It's an addiction. So that's great to see. I think any barriers that you can remove for people that want to make that step towards being smoke-free is great. I mean, I think even having the option to be able to talk to an RN and make your intake on the phone is huge, especially during COVID. So I'm really happy that that was added to the program. So I think we're doing pretty good here, but thank you so much for this presentation. I think it just really helped highlight the issue of smoking cessation, some of the products and services that are available on PEI. We're very lucky in this province. Many other provinces in Canada do not have access to this type of program. So really great. And if anyone has any questions after the call that they think of, please just send them to the PEI Lung address. So it's peilungassociation@gmail.com, and we can forward your questions on to our presenters and get the answers that way. Anyways, okay, thanks so much for everyone for joining today, and have a great day.
Thank you.
Bye.
Bye.